We're now going to start on narrow complex tachycardias. So typically when we talk about the mechanisms responsible for these tachycardias, we talk about three different ones. The first one is increased automaticity, and this is where we have an increased phase 4 depolarization. If you have increased sympathetic flow to the heart, the increased sympathetic activity will act on phase 4 of the cardiac potential, and it will increase the gradient. And therefore the depolarization will come earlier than expected, and that will lead to a faster rate. This is how you get a sinus tachycardia. The automatic tachycardias caused by increased automaticity will sometimes show a warm up or a warm down phenomenon, especially if you have a long run, say on a 24-hour tape. You could recognize that. So this is where the tachycardia will self-terminate in the absence of any premature atrial complex, for example. The second mechanism is triggered activity. Here you have oscillations in membrane potentials following the preceding impulse. They're called after depolarizations, early after depolarizations, or delayed. Principally, they are caused by a calcium overload within the cell. When one of these after depolarizations meets the threshold for activation, it can trigger an arrhythmia. A classic example would be digitalis toxicity. Now, digitalis inhibits the sodium-potassium ATPase, and this increases the amount of sodium inside the cell. And a sodium-calcium exchanger will transfer the sodium for the calcium, and you'll have an increase in calcium inside the cell. So this is also the mechanism by which digitalis increases the contractility of the heart, but it also increases the likelihood for after depolarizations. And it's by this mechanism that these after depolarizations can cause ventricular fibrillation or ventricular tachycardia in the case of digitalis toxicity. So the third mechanism is re-entry. If the impulse travels around an electrically silent area of myocardium, if it takes long enough to come back around on itself, it can depolarize once again those cells that have undergone depolarization and repolarized as well. And it can cause a loop. The re-entry tachycardias are often initiated by a premature atrial complex. This is the case in atrial flutter, for example. And you have a pretty large re-entrant circuit that travels around the atria. The most common type is when the electrical impulse travels around the right atrium, along the cavotricuspid isthmus created by the tricuspid valve and the inferior vena cava. This is your typical atrial flutter if it's going in a counterclockwise direction.